Hey, stop what you're doing right now, because what I'm about to share with you could genuinely save your life or the life of someone you love. Most people think hantavirus is something that only happens to other people, in faraway places, in extreme conditions. They think it's rare, exotic, almost fictional. But I'm here to tell you today that this silent, invisible killer is closer to home than you ever imagined. And the medical establishment has done a shockingly poor job of warning the people most at risk, adults over 60. I'm Dr. Thomas, and in my years of practicing medicine, I have seen how quickly hantavirus pulmonary syndrome can steal a person's ability to breathe, move, and live independently. A study published by the Centers for Disease Control and Prevention found that hantavirus pulmonary syndrome carries a case fatality rate of nearly 38%, meaning more than 1 in 3 people who contract it do not survive. And here's what nobody is telling you. Older adults with even slightly compromised immune systems face dramatically worse outcomes than younger patients. Today, I'm going to walk you through everything, the symptoms you absolutely cannot ignore, the hidden risks lurking in places you visit every single day, and 5 powerful prevention strategies ranked from helpful to absolutely critical. And I'll be teasing number 1 early, because when I tell you what the single most overlooked prevention method is, you are going to be stunned that your doctor never mentioned it. But before we dive in, I want to ask you something personal. Leave a comment below telling me your age and whether you've ever lived near a rural or wooded area, even just a vacation cabin, a garage you clean out seasonally, or a garden shed. I read every single comment on this channel, and your answer genuinely helps me create content that protects people just like you. Now, let's start with what hantavirus actually is, because understanding your enemy is the first step to defeating it. Hantavirus is not a new threat. It's a family of viruses carried primarily by rodents, and it has been quietly circulating in the Americas for decades. In North America, the primary carrier is the deer mouse, a small, seemingly harmless creature that looks almost nothing like the rats most people fear. The virus lives in the saliva, urine, and droppings of infected rodents. And here is the terrifying part. You don't have to touch a mouse to get infected. Simply disturbing dried rodent droppings, sweeping a dusty shed, opening a long-closed cabin, rummaging through an old storage box can send microscopic viral particles into the air. You breathe them in without knowing it, and within 1 to 5 weeks, your body begins to wage a war it may not be equipped to win. For adults over 60, the immune system has already been quietly declining for years. After the age of 65, the thymus gland, which is your body's training ground for immune cells, think of it like the military academy for your white blood cells, has largely stopped functioning. This means your body's first line of defense against a novel virus like hantavirus is significantly weaker than it was at 40. The virus exploits that vulnerability with brutal efficiency. Now, let me tell you about Margaret, a 71-year-old retired school teacher from Flagstaff, Arizona. Margaret was a healthy, active woman. She walked 3 miles a day, ate well, and had no serious medical conditions. In the spring of last year, she decided to clean out her storage shed, something she'd been putting off for 2 winters. She wore no mask, used no protective gear, and spent about 2 hours in there moving boxes and sweeping the floor. 3 weeks later, she was in the intensive care unit on a ventilator, fighting for her life. Her family had no idea what had happened. Her doctors initially suspected pneumonia. It wasn't until day 4 that hantavirus pulmonary syndrome was confirmed. Margaret survived, but just barely. And she told me afterward, "Dr. Thomas, I never even saw a mouse." That is the nature of this disease. It strikes without warning, and it mimics so many other conditions that it is frequently misdiagnosed until it reaches its most dangerous stage. So what are the symptoms, and when do they appear? The disease progresses in 2 distinct phases, and knowing both could be the difference between life and death. The first phase is called the prodromal phase, which simply means the early warning phase. It typically lasts between 2 and 7 days. During this time, most people experience fatigue so profound it feels unlike ordinary tiredness, more like a heaviness in the bones. You may have fever, chills, muscle aches primarily in the large muscle groups like the thighs, hips, and back. Many patients also report headaches and abdominal discomfort, including nausea, vomiting, and diarrhea. Here is the critical danger. Every single one of these symptoms is indistinguishable from a common flu or stomach virus. This is why so many patients, especially older adults, dismiss it and wait at home. After 60, your body's ability to signal distress has been blunted by years of accumulated inflammation. Researchers at Johns Hopkins University describe this as inflammaging, a chronic, low-grade inflammatory state that makes it harder for the immune system to mount an obvious, dramatic response. This means the early symptoms of hantavirus in seniors may feel even milder and more ambiguous than they would in a 30-year-old. You may feel just a little off when in fact the virus is already multiplying rapidly inside your lungs. Then comes phase 2, and this is where Hantavirus Pulmonary syndrome earns its terrifying reputation. Within hours of the prodromal phase ending, sometimes as quickly as 24 hours, the patient enters what is called the cardiopulmonary phase. The lungs begin filling with fluid. This process, called pulmonary edema, happens because the virus attacks the tiny blood vessels inside lung tissue, making them leaky. Imagine your lungs as a sponge, normally dry and efficient, able to pull oxygen from air with ease. Hantavirus turns that sponge waterlogged. Breathing becomes labored, then desperate, then impossible without mechanical support. Blood pressure drops. The heart begins to fail. In many cases, patients deteriorate so rapidly that they go from walking into an emergency room to requiring a ventilator within 24 hours. For adults over 70, whose cardiovascular systems are already working harder due to decades of normal aging changes, this collapse can be devastatingly swift. There is no specific antiviral medication approved to treat hantavirus pulmonary syndrome. Medical teams can only provide supportive care. Oxygen fluids, sometimes ECMO, which stands for extracorporeal membrane oxygenation, a machine that essentially breathes for you by oxygenating your blood outside the body. The survival window is narrow, and it hinges almost entirely on how quickly the diagnosis is made. This is why prevention is not just preferable, it is everything. And so, I want to walk you through 5 prevention strategies, ranked from 5 to 1, from genuinely important to absolutely non-negotiable if you are over 60 and have any exposure risk whatsoever. Coming in at number 5, understanding and avoiding high-risk environments. This sounds simple, but the application is more nuanced than most people realize. Hantavirus hotspots in North America include the Four Corners region spanning Utah, Colorado, New Mexico, and Arizona, but cases have been confirmed in 34 U.S. states and throughout rural Canada. High-risk locations are not just wilderness cabins. They include garages and storage units that have been closed for a season or more, crawl spaces beneath homes, barns, and agricultural outbuildings, vacation properties that sit vacant in winter, and even heavily wooded suburban backyards where deer mice are increasingly colonizing. A 2019 analysis from the University of New Mexico found that residential exposure, meaning people getting infected in or around their own homes, accounted for nearly 60% of confirmed cases. So if you are 65 or older and you're planning any cleaning, renovation, or clearing of a space that has been closed or unused, that activity immediately qualifies as a high-risk activity. Awareness is the foundation of everything else on this list. Moving to number 4, rodent-proofing your living environment. The science here is direct and powerful. A study from the National Institute of Allergy and Infectious Diseases found that homes with even minor structural gaps, openings as small as a quarter inch, roughly the size of a pencil, are vulnerable to deer-mouse intrusion. After 70, many people live alone or in homes they've occupied for decades, where weather stripping has degraded, foundation cracks have widened, and gaps around plumbing have never been sealed. Deer mice can collapse their bodies to squeeze through almost any gap because their skulls are flexible. They do not need a large opening. What you need to do is conduct a full perimeter inspection of your home, ideally with the help of a licensed pest control professional, and seal every potential entry point with steel wool packed into gaps and covered with caulk. Steel wool because rodents cannot chew through it effectively. Inside your home, store all food, including pet food, in hard-sided, airtight containers. Keep firewood stored at least 100 feet from your home's foundation. Remove any piles of debris, leaf litter, or clutter from around the exterior because these are nesting sites. Now let me tell you about Robert, a 68-year-old retired electrician from rural Oregon. Robert had noticed mouse droppings in his garage for 2 seasons, but kept putting off the cleanup. After watching one of my earlier videos on respiratory illness risk factors, he finally called an exterminator, sealed his garage, and replaced the weather stripping on every door. He told me he found 4 active entry points along his foundation alone. I had no idea, he said. I thought a mouse would need a big hole. Prevention, when practiced early, is 100% effective. Approaching the midpoint of our list at number 3. And before I get there, if this information is opening your eyes, please take a moment right now to subscribe to this channel and hit that like button. I have a team dedicated to researching and presenting exactly this kind of life-saving content specifically for adults in their 60s, 70s, and 80s, and your support makes that work possible. Now back to number 3, proper protective equipment during any rodent exposure cleanup. If you are going to clean any space that may contain rodent droppings, nesting materials, or carcasses, and I mean any space, including your own attic, basement, or garage, you must never use a dry broom or vacuum without a HEPA filter. This is critical. Dry sweeping and standard vacuuming aerosolize the viral particles in dried droppings, sending them directly into the air you breathe. The CDC recommends a specific cleaning protocol. First, open windows and ventilate the space for at least 30 minutes before entering. Then wear an N95 respirator or higher, not a simple dust mask, which does not filter particles small enough to contain the virus. Wear rubber gloves and disposable clothing or clothing you will immediately wash in hot water. Spray droppings and nesting materials with a disinfectant solution. A mixture of 1.5 cups of bleach per gallon of water works effectively against hantavirus, and let it soak for 5 full minutes before wiping up with paper towels. Bag everything in sealed plastic bags and dispose of it in an outdoor trash container. For adults over 65, I would add one more strong recommendation. Do not do this cleanup alone. Have someone with you who can monitor your condition and call for help if needed. Number 2 on our list, and this one surprises almost every patient I mention it to, the profound importance of maintaining your immune health as a daily antiviral defense. Let me explain the science here carefully, because this is where age becomes a specific and significant risk multiplier. Researchers at the Stanford University School of Medicine have documented that after age 65, the immune system's T-cell response, T-cells are your body's specialized virus-killing soldiers, declines by approximately 45% compared to a person in their 30s. This is not a minor reduction. This means your body is fighting viral threats at less than half its earlier capacity. This phenomenon, called immunosenescence, is the reason that respiratory viruses of all kinds, including hantavirus, are disproportionately fatal in older adults. What can you do about this? The research is clear on several daily practices that genuinely slow immunosenescence and strengthen the specific immune pathways needed to combat viral infections. Vitamin D deficiency and studies from Harvard Medical School show that more than 70% of adults over 65 are deficient is directly linked to weakened innate immune response, which is the rapid first responder system your body deploys against novel viruses. Adequate sleep, specifically 7 to 8 hours of consolidated sleep per night, is when your body produces the highest levels of cytokines, which are the signaling proteins that coordinate your immune attack against pathogens. Think of cytokines like a military communication system. Without sleep, that system goes offline. Chronic psychological stress elevates cortisol, which directly suppresses immune function. Regular, moderate exercise, walking 30 minutes 5 times a week, has been shown by researchers at the University of Bath to increase natural killer cell activity by up to 35%. These are not abstract lifestyle tips. In the context of hantavirus, a stronger immune system could mean the difference between surviving exposure and not surviving it. Scientific references for all of these studies are listed in the description below. And now, number 1, the single most overlooked, most underemphasized prevention strategy for hantavirus pulmonary syndrome in adults over 60. The one thing your doctor almost certainly has never discussed with you in the context of this virus: aggressive early medical escalation at the first sign of unexplained flu-like symptoms following any potential exposure. I told you this would surprise you. Here is the truth that the medical system fails to communicate clearly enough. Hantavirus pulmonary syndrome is nearly always survivable if treated with full intensive support before the cardiopulmonary phase begins. The fatality rate drops dramatically, from nearly 38% overall to under 10%, when patients receive intensive care in the early prodromal phase before the lungs begin flooding. The problem is that most older adults wait. They wait because the early symptoms feel mild. They wait because they don't want to overreact. They wait because they've been conditioned to tough things out. And by the time they seek care, the window has closed. Here is my prescription to you as your physician through this screen. If you are over 60, if you have cleaned a shed, visited a cabin, worked in a garage, or spent time in any rural or wooded environment in the past 6 weeks, and you develop a fever with muscle aches and fatigue that feels disproportionate to a simple cold, you go to an emergency room, not urgent care, not a telehealth call. You go to an emergency room and you specifically say, I may have had rodent exposure and I need to be evaluated for hantavirus. Those words matter. They change the diagnostic pathway immediately. I want you to think about someone you love who is in their 70s, living independently, proud of their health, and cleaning out a garage this weekend. This knowledge is the difference between their story ending in an ICU and their story continuing for another decade. It is never too late to protect yourself. The quality of your independence, the ability to wake up tomorrow morning in your own home and make your own coffee and call your grandchildren, all of it is worth fighting for. All of it is worth a trip to the emergency room and an honest conversation with your doctor. If this video helped you today, please subscribe to this channel, share it with someone over 60 in your life, and leave me a comment below. I want to know, have you ever had a potential rodent exposure without knowing it might be dangerous? Tell me below. I read every comment, and your story might just save someone else's life. I'm Dr. Thomas. Stay informed, stay protected, and I'll see you in the next video.